depending on what we eat, I'm sure we've all gotten heartburn from time to time, but sometimes heartburn can be a sign of a more serious issue that you should consult a doctor about. And here to help us know the warning signs of acid reflux and GERD are two doctors from Virginia Mason Franciscan Health, Peter Blais and Misho Hupka. Welcome to New Day to you both.
Thank you, Kelly.
Yes. So Dr. Blais, we're going to start with you. Heartburn is something that most people experience at one point or another, but how do you know if it's getting to something more serious?
Thanks for having us, Kelly, and you're correct. Heartburn and reflux-related symptoms are some of the most common things that we see in clinic, and it's so common that most of the time your natural intuition is correct in that you can start low and go slow, as long as you know it's sort of got a typical trigger. You had a dietary indiscretion, a heavy meal one night, alcohol use that night. The next morning, if you feel that feeling, dietary modifications, lifestyle modifications, and then taking an antacid here and there should be just fine. The sort of gray area that would necessitate talking to your primary care provider and then seeing one of us would be if these things become more regular, if it becomes more consistent, no particular food triggers, you're having episodes twice a week for a couple of months, then you should go see somebody about it.
Definitely. And when does it even get to a point then where it's a GI specialist and even a surgeon like you were discussing too?
Yeah, so there are two things to keep in mind. One is alarm symptoms and the other one is risk factors. And so alarm symptoms are things like swallowing problems, pain on swallowing, appetite loss, weight loss, and seeing blood in any direction, new symptoms after the age of 60. If you were to go to your primary care doctor with any of those things, they would send you to us pretty quickly. The other one is risk factors, and that really lowers the threshold of going to see one of us right off the bat. And those are things like being obese, being advanced in age, actually having a Caucasian race increases your risk of things like esophageal cancer as well. And then having persistent symptoms over years and years, because the number one risk factor for something like esophagus cancer is having unabated, uncontrolled acid reflux.
Wow. Anything too else, Dr. Hupka?
No, so when patients come and see me, a surgeon, obviously they have gone through the process of workup and have seen a gastroenterologist before. In fact, Kelly, as we were waiting to film this segment, every single one of your team members asked us about their GI symptoms.
Oh, wow.
Yeah, and so it's very, very common, and so it's very important that you don't see surgeons unnecessarily. However, if you need an anatomic correction, which we'll talk about later, for your reflux because medications do not work or you do not want to be on medications long term, then it's important to see a surgeon.
Yes, and Dr. Blais, what are PPIs too, and what should people know about these, and if there's any long-term risks associated with these medications?
Yeah, so if you have regular heartburn symptoms and we're really suspecting acid reflux as the diagnosis, you talk to your primary care doctor. The most common thing they're going to do is give you a trial of a medication in this PPI drug class. Proton pump inhibitors is the acronym. These are medications like omeprazole, pantoprazole, anything that ends in prazole. Brand names, things like Prilosec, Nexium, Protonix. Very widely used, one of the most extensively studied medication classes out there. But I think as the research has gone along and as patients have taken this for years and years and decades, the concern about potential for side effects or adverse effects over long-term use has grown. I have to say from our anecdotal evidence and looking at the research data, a lot of it is overblown. Every one of us has over 100 patients taking these meds for over a decade and they're doing just fine. Things you really have to think about and watch out for are things like osteoporosis, increased risk of infection like pneumonia, or this thing called C. difficile colitis. And then this entity called SIBO, which is an acronym for small intestinal bacterial overgrowth. It's not an infection, but an imbalance of your microbiome where the typical symptoms are gas, bloating, and loose consistency stools.
Okay. And Dr. Hupka, if these medications, though, aren't enough, what surgical options are out there?
Yeah, so when we see a patient who has what we call medically refractory reflux, so they've tried medications for a long time, they're not working, first thing we do, we assess them anatomically. And the reason why reflux happens, because there's breakdown of the anti-reflux barrier. So reflux is actually an anatomic problem which we treat chemically with medications. And so we assess the patients anatomically. We see if they have a hiatal or what we call paraesophageal hernia, meaning the top of the stomach is protruding into the patient's chest. And then if we need to correct it operatively. The options are, if the hernias are very small, we can actually do that through the mouth without any incisions. However, if the hernias are larger these days, minimally invasive surgery is the mainstay therapy, is the standard of care. At Virginia Mason, we do all these operations with the use of the surgical robot.
Okay, and last question, any last key advice for anyone with acid reflux or GERD that you want to tell people about?
You know, as common as these things are, you definitely don't want to sweep it under the rug. We talked about these risk factors. So esophagus cancer is not a common cancer, but it's something definitely that's preventable that you can screen for, just like colon cancer, if you have the right risk factors. In fact, if you have, say, a relative who's a Caucasian male over 50, obese, they don't have to have much more. They don't even have to have reflux symptoms. If they were going to go to their doctor to get a colonoscopy for screening, they should also have an upper endoscopy as well. And then other things like tobacco use or alcohol use further precipitate the risk of acid reflux and definitely necessitate them to get checked early.
Thank you so much for you both being here today. This was really informative, and we love having you both here at New Day.
Thank you, Kelly.
Yes,
Thank
and
you.
for more information on what we discussed today and to get in touch with Virginia Mason Franciscan Health, just visit the website that you see right there on your screen.
This portion of New Day Northwest is sponsored by Virginia Mason Franciscan Health.